Hello everyone, it's Unit 13 here on scene at the Homestead, and I want to share with you this Dyna Maxi-Medic bag. It's model number BG087 ORG. That's Bravo Golf 087 Oscar Romeo Golf. I've been using this bag, this model bag, not this particular one, but this model bag since the early 80s with the various services that I worked with, and then I purchased one for my own personal use. And I think this is the third one I've been on. It's usually the zippers that get it, and my experience is when people do this with their zipper, these real fast jerky movements, that's when they mess their zippers up. That's been my experience. Every time I've done that kind of thing, that's when the zipper gets jammed or it goes off track. So I just don't do that anymore. Problem solved. And then since I mentioned the zippers, the one thing I did add to this bag is the zipper pulls. I added these just to make it easier to get a finger in if something's going on. In cold weather, it's hard to move your fingers or some. This is also, remember, a kit for aiding my own self. So in a cold emergency or whatever, my fingers are slippery, I can get this off real easy and close it. Let's see, did I mention the bag's $1,000? It's 1,000 denier nylon, not $1,000. If it's $1,000, I wouldn't buy this bag. All right, it's 9 inches high, 20 inches wide, and 12 inches deep. I guess that's how they're going, yeah. And what else do I have? You know, I like this here, that there's no webbing on the bottom, like some of their other bags. But it only pulls in these two portions here. I think that's about 1.5 inches. So it just pulls right at the joint. So all the weight that's in here is just sitting right there. I'd really like it if there was a web going all the way around. That way it's pulling all the way on the bag. Although, I have to say, I've never had a problem in any of these portions here or with any of this hardware of any kind. It's only when the zippers get jerked is when you have troubles. There is reflective material. The Star of Life on the top here is reflective. Both side compartments have reflective material on it for conspicuousy, make it a little bit easier to see. The scope of practice of this kit is to treat the most common basic injuries, minor injuries I should say, finger cuts, minor lacerations, arm or finger fractures, and vital signs. It's just the most common things that I've ever seen, just basic stuff, both just around the house and out professionally. It's all based on, like public events. I've been a medic at lots of public events, from sporting events like the stock car races to the high school football game, county fair, church groups, hunting camps. Really a lot of different places where they need first aid coverage. And then all my experience as a firefighter paramedic in the fire service, working directly with the military as a civilian medic firefighter. There's a lot going on there. So it's all based on that. So my first kit, this one here, this is my aid bag. It's real basic. It's just gonna get the basics started. If I need anything more advanced than that, then I'll move to someplace else. Excuse me. Yeah, this side here, or this alpha compartment, this is what I use for splinting up patients. I'll start off with, because this kit is used by multiple individuals, not just myself, and people of various, it could be a physician using this kit or somebody with basic first aid training. And you know, if you don't use things all the time, you don't always remember. So we have references. You'll see more here later. I do have some splints, but I'll start off with that. Here we go. There's a 9-inch SAM splint and a 18-inch SAM splint. These are all good for small fractures, arm fractures. You could use some of these on children as well for legs, but Mostly this is for forearm down to fingertip splinting. If I need more than that, I'll go to another kit that's more advanced for leg fractures, fracture where I think that I'm going to need a traction splint or something like that. Okay, we'll stick to this kit. So these are just for basic fractures. The my first line of fracturing. If I need, like I say, if I need more, I'll move on to another kit. If I have a finger injury, or where I believe there's a fracture, or I want to immobilize that finger for some reason, I don't use this. This didn't come out of the kit, but I have it here because I've never used them. I've only seen them used after somebody's been x-rayed, not beforehand. So I'm not going to get into like the how and whys on this. This isn't that type of video, but you know, I'm not going to be bending a fracture straight to put it into this thing. So that doesn't go in my kit. Only these SAM splints. If I was to splint a finger, somebody's going to get their whole wrist and hand splinted. Okay? They're going to get their whole wrist and hand splinted, and most likely, I'm going to splint all the way up to the forearm. I mean, all the way the whole forearm, everything. I want everything immobilized in here because if you understand the anatomy of this, just take your index finger sometime and put it up on the front deltoid, and you can feel that movement all the way, carry all the way up into that deltoid. So that's why I like to immobilize everything just for even a simple finger fracture or a suspected finger fracture. Okay? And to wrap these up, or any other type of wound, I do have various bandaging materials. See, the first thing that I have on my list is, where's the triangle triangle bandage. Here's the triangle bandage. It's just an all-around good body bandage for immobilizing your shoulder, your forearm, whatever. There's so many things I can't generalize it here on this video. I guess a triangle bandage calls for its own video, and there's only one in here. If I need more than that, like I say, I'll go to another kit. We have self-adhering wrap. It's called, I think 3M calls it Coben or something like that. Everybody's got a little different name for it. This stuff is really fantastic for bandaging, especially like in wet conditions or for animals. It's some really good stuff. The thing to remember is it does have this stretch to it, so when it's applied, you need to account for that and not overdo it. Otherwise, you'll have a constrictive bandage when you may not want one. Like that. This is really great material. I like to keep like a 3 or 4 inch roll and then 2 inch on hand. These are just some scraps I picked up. Somebody was getting ready to get rid of. I'll throw those in the kit. Tape. I usually have one more different type tape in here, which is elasticon tape. And got paper tape, waterproof tape for wrapping wounds. I try to keep all my tape products in Ziploc bags no matter what, because it really bothers me when the edge of the tape starts picking up crud and crap. I don't want that near my patients. I don't want that anywhere near my patients' wounds. So I try to keep my tape always protected in a Ziploc. And like I say, waterproof tape, paper tape, especially for like sensitive skin on face. And then I have this sports tape as well. I also have an elastic tape I usually keep on hand, but I'm out of it. I found out the stock that I had, completely all the adhesive dried on it, so I've got to order more. And then elastic bandages, various sizes, and they're reusable. That's what's really nice about these. So a person that gets one of these can use it over and over. You can see that there's 2 of these that are out of the original package and in a Ziploc, and that's because they've been used several times. So we have elastic bandages. The last note that I have for that compartment is to measure it for you. It looks like that this compartment here is approximately 11.5, maybe 12 inches in diameter, I was going to say. I believe it's 6 inches, about 6 inches there, deep, maybe a little bit taller. And approximately 2.25 to 2.5 inches across here. Okay, everything's put back in the alpha compartment. What I'm going to show you now is the lid. It's just got a little zippered pouch up here. It's mesh. I've got several items in here. This is just a reference for a tourniquet, so that's really not necessary to show you that. I've never seen a fingernail file in a case like this, so that's why I grabbed it. I thought it'd be great for the first aid kit. If you've ever had a fingernail emergency, you'll know exactly what this is for. I have 2 bite sticks in there in case I run into seizure issues. Going to quickly at least keep them from biting their tongue off or causing tongue trauma if that's what's going on. I also have a little kit for the stethoscope that's inside of here. So if I need to use a bell or replace a diaphragm or change the earpieces, I can. And here's this. I'm going to measure this pouch real quick and then show you what I don't like about it. So I'm going to go from here to here. So it's really about 9 inches on the interior, and then going from the inside of that zipper down to here, you're going to get about 5.25 on the inside, roughly. Okay. If you have stuff in this here, like this, and you just want to pull something out and then you run off to let go somewhere, this is what's going to happen. You'll end up with stuff. This zipper caught that, but I'm lucky that it caught it. Normally it just flies right out of there. So what I think would be a better idea for that is to take this and take this when they sew this onto the piece of fabric, just turn it so that the zipper's up here. That way, when you open it, one, you don't have to be holding this to do it. See what I mean? If it was the other way, you could just use one hand. And then, if it was zipping from here, up on this section here, you could let go of it. And then zip it here, one hand or the other. And then work out of that little pouch from here. In addition to that, if you forget to zip it or it didn't get zipped up all the way, anything that might potentially comes out, every time you close it, you're just tipping it straight back inside the bag here. So that seemed like the way to go to me. If I was to make this bag, that's exactly what I would do. I'd have that up the other way. All right. Let's get into the main part of the compartment here. I think that's centered pretty good on the screen. I have a couple of things here. I have a composition book, which is just a notebook. It's basically a diary of any aid rendered out of this kit. If I give somebody a Tums or a Band-Aid, I'm still going to write it down here just to keep track of what I do out of it. And then in addition to that, I've also got a waterproof notepad so that if I do need to be taking notes, I'm not going to enter it into this book. I'm going to have this here with me when I'm talking to a patient into the information here, and then it'll get transferred over to here later. Well, I like that waterproof option living in Florida, especially as much as I sweat. If it was in my pocket, I'd get it wet just standing there. So, all right. Composition book or a little diary. Enough of that. Here's our stethoscope, spag rapport, typical stethoscope. And that's why I have that kit, so I can put a diaphragm on here if I want to. And change out these earpieces. I have these on here for everybody to use, but I like the mushrooms better. Anyway, enough of the stethoscope. We'll start over here in this little pouch, or kit, or section, whatever. Oh, wait a minute. Actually, here, let me go here. On top of everything, I forgot. Really, when you open a bag, there'll either be if there's a pouch in the front here, or anywhere else. Usually I'll put the glove bag there, but since I don't really have that, I'll put the glove bag here on top. That way, when the kit's open and this thing comes off, you can grab the first thing you want to grab before you really touch anything else anyway, is gloves. The only thing missing from here that I see are my earplugs. I usually have earplugs in here, and there could be some intermingled with these gloves in here, but I usually have earplugs in there for all the reasons that you want earplugs. Sometimes babies are crying at such a high pitch, it'll hurt your ears. So I wear earplugs if I have to. Or sometimes get a call to the scene of where there's really loud machinery and you'll need it. Make sure you always have it. And the other thing I like about the glove bag is I can just grab this and stick it in my pocket. So then when I start doing some kind of first aid thing, I'll have several pairs of gloves on me at any given moment. That way I can just reach down in the pocket and replace a glove or an entire set of gloves if necessary. In addition to that, I always walk around with a pair of safety glasses. So these are in here for either an assistant or if something happens to my glasses. Sometimes they'll get scratched up on me and I need a different pair. So there you go. Safety glasses, nothing fancy. Going on my list here, make sure I get everything. Okay, now I'm going back to this little pocket. Let's start here. Lister bandage scissors. I've used these more than I do your typical trauma shears out on calls because they seem to work better on everything that humans wear typically. And that those shears, I don't know, I've been kind of let down by them a lot over the years. And I only use them for if I'm trying to cut some really heavy fabric or something. That's it. Otherwise, a good old pair of what are these 7.5-inch Lister bandage scissors really work well. So that's what I use. Okay, we have tongue depressors. I don't want to handle them. Tongue depressors are, well, they have multiple uses for looking in the oral cavity, checking, moving tissue out of the way, moving the tongue. They can be used to scoop ointment up. Let's say, for instance, I want some of this bag balm and I want to hand some off to somebody. And I don't want anybody sticking their fingers in this, so I'll scoop this out with tongue depressor. And I don't know if I mentioned it could also be used as a splint. You can put that next to fingers and splint them next to that. Give them something stable. And also applying ointments, not just scooping them up. And that's the same reason that I have these cotton tip applicators. Oops. It's just a fancy Q-tip with a wood stick. Well, these are really handy for a lot of different things. I have them in here specifically for applying ointments or moving tissue again. You might have to approximate something or push something. I don't want to be handling it. I might use this, particularly if you're doing sutures. Okay. I'm going to empty that out, actually. Okay. Ring cutter. Typical ring cutter. For most of your, this will get you out of all your soft metals, or most of your typical rings. And then I think they're making, what's it called, titanium rings now that this won't cut. And I think there's some ceramic or some ceramic blend something that this won't cut, but you can use a vice grip will crack it, which will give you the same result. And That's all you need. You got to relieve that pressure. So if any of you are familiar with this, just if there's a ring on somebody, slide it up under the ring. You bring this blade down on top of the ring. There's a little place to catch it so the ring sets in here. I don't know if that's visible or not. And then you apply pressure with your thumb to grab that ring in there between this and then this saw blade right here. You just rotate it with your finger. It's a real gentle thing. No big hurry. And within, I think usually about a minute, you'll be through the ring. Unless it's a big, thick class ring base or something. Anyway, it's a really nice tool. And we also have another toolkit close by in case somebody's got one of those that has a pair of one of those hard metal or ceramic ones. In case somebody has those on, we have vice grips. I got confused there for a second. It's distracted. The cats are. We have house cats, as you can imagine. They're over here telling me that they should be fed right this second. Okay. Hand sanitizer. Just a little bit of hand sanitizer. A couple of topical ointments. One is this. Here, I'll just take it out of the package so it's really clear. One is this Silver Queen. It's one of those silver-based creams. And then Neosporin, and the antibiotic. This is technically for animals, but I wouldn't hesitate to use this stuff. It's really nice. Okay. Use it on burns and things like that. Any ointments, creams, anything like that that might leak, always gets a bag around it. But usually in this kit, the common theme is most everything does have a bag, except for some of these dressings, because if it does get exposed to water, it'll be done. A few ammonia inhalants. I'm not going to give you the ins and outs of it, but you know, if you got asthma, you don't want to be around this thing. Or if you have a patient that's asthmatic, you sure don't want to give it to them. Or stick this under their nose. But this is what it is. Some. Oops. Yeah, it's a little hard to see that without taking it out of the wrapper. It's betadine. We use this for all kinds of different things. Cleaning up the mess. All right, that's everything out of there. Whoa, that stuff's escaping. Next little compartment is a hot pack, an instant hot compress. For all the reasons that you might want one. And down below that are a couple of cold compresses. I have some of these other ones of this brand here, cold compresses, but I got these when I was at the dentist, and they were not in these nice boxes. I didn't use them, so I just put them right into this kit. Then also I have this eye kit. It's one of these little boxes I got at the Container Store. All right, what's in here? Really quick, I'll show you. An eye shield, just a single one. If I need more, I'll go to another kit. A couple of these, a 5-pack of the Refresh Plus eye wetting drops. A hard contacts or prosthetic eye suction cup. That's a suction cup for removing hard contacts or prosthetic eye. If you need to get contacts off of somebody, or they need to, and they've got something on their fingers or something, this is the surefire way to do it without contaminating the site, ruining your contact lens. And then here's a place to put contact lenses. Okay. that's about it for the eye kit. If it's more in depth, I've got another kit which I'm going to do a video on that would cover more in depth stuff that have to do with the eye. Cat tourniquet, and more along the lines of eye care and irrigation. I've got this eye cup here. Gosh, it's really hard to see on this screen, but it's a sterile eye cup. You fill it up and you can irrigate your eye with it. Eyes. And once again, more irrigation material. More of this Refresh Plus drops, another 5-pack. And then here's some of this Saljet rinse. It's a saline solution in a 30 ml little plastic bottle. I have some of these in my personal kit that I keep in my kit that I carry with me everywhere in case I ever need to irrigate my eye and instantly for some reason. This will get you there. Hope that's visible on that screen. It's really hard to tell. I'm trying to get moving here. Kind of running along. This video. Get you covered here. All right. Okay, we also have 2x2s. Some sterile 2x2s are packaged up here. That way if, goodness, once again, anything you might use a 2x2 for, mostly I have these in case there's like an oral injury or maybe an eye injury. I can cover it with this, or somebody can apply direct pressure in the oral cavity with some of these to help prevent bleeding in there if something's going on. Iodine swabs for everything that you use the iodine swabs for. Wound care, this is a wound care kit. Some of these Telfa non-adherent bandages. I might put this down and throw a 4x4 over it, or something, or even more 4x4s just to get some spongy effect. And then I'm going to move that stuff over here so it doesn't fall. And Krolex. I used to carry Cling and Krolex. I've replaced all Cling with Krolex, and I carry exclusively the 4.5 inch Krolex in place of that anymore. It's so useful all the way around in so many different ways. I'd rather just carry this one type of wrap along with the elastic bandages, or the self-adhering bandages will get me through everything. Okay. Going to move on to this little diagnostics compartment here. Actually, you know what? Before I start that, let me show this other little laminator. Oh, you know what? I will wait for that to the end because I'm going to take this insert out. It'll be easier to deal with then. I also have, there's an old, this is really hard to see that, but I don't know if you can see how old and yellow this package is. But that's one of the last Cling rolls, that 3-inch Cling wrap. That's one of the last ones I have right there from a long time ago. Okay, let's get right to this little kit here. This has my pen light in it. This pen light, it's a through night. It's a TI5T. Single AAA battery. Since I can wipe this down and pretty much disinfect it, so that's why I've got this, and it works good. The only thing I don't like about it is that strobe feature. That really annoys me on flashlights. I wish they would stop doing it. It's so stupid. Okay, if you've ever had I'm going back to that nail file. If you've ever had a fingernail emergency, you'll know why this is in that kit, and why I kick one of these everywhere I go. I have a fingernail, because you really mess your day up if you get the wrong fingernail injury. I mean, it'll stop you dead in your tracks, and you won't be doing anything else the rest of the day. So it seems like not much till it happens. All right, and then I know that working at those sporting events, I'd never thought of ever putting something like dental floss or toothpicks in a first aid kit until I started working at those sport events. Now, I've always carried these things on me personally, meaning that I would have this in an ambulance with me on a call in my own personal gear that I kept with me, either in an ambulance or a fire engine, because I've had my own issues with needing suddenly, wow, I really need to get that out of my tooth now, it's driving me insane. So anyway, that's where this comes from. I've worked at sporting events and actually had people walk up to me. I know this is an ambulance, but does anybody have a toothpick? Just a toothpick can really go a long way. So, like I say, it's a first aid kit. Toothpicks and dental floss can go a really long way. The other thing that's in here is thermometers. This is our diagnostics part, where we start getting into vital signs. I have a rectal thermometer and an oral, and 2 oral ones here as backup, and these can be used rectally if necessary. I have the covers in addition to that, so that they don't get too gross. And of course, spare batteries. That works really nice in that little kit. Better put that behind me. See if I can pick up the pace on this. I do have a battery operated BP cuff because it's I don't rely on it. I use a Noble BP cuff and a stethoscope when I want to know what a blood pressure is, for sure. But if I'm working by myself and I need to be monitoring a patient somehow and taking the time to do a normal blood pressure when I could just push a button on this and get a good rough idea that things are okay, that's what I'm going to do. So that's why both of these are together in the main kit here, because I might want to plug somebody directly into that if they showed up conscious or unconscious. And then my little battery packs. You notice that they are the Kirkland batteries in there and that they're whittling down. I'm never buying Kirkland batteries ever again. I've had them ruin way too many things. All right, enough of the batteries. It's just a little sharps container. I have a sharps container in all of my kits, so that way you never know when you're going to need to put something sharp away, and that's what that's all about. I also have a pulse ox in here. Let's see. Sorry, I just dropped something off my mic. There's my little pulse ox. It's a known in onyx. This is the same one that they issue to military personnel, or they did. I don't know if they're still doing it. It's a nice little unit. It's, you know, what can I say? It works. And I can set it on a patient just like I can that automatic BP cuff machine or BP machine, and know what some of the vitals are without having to make too much effort. In addition to that, these are all things that I'm going to want to know right away with somebody. I've got my glucose meter on here. This is an old Tylenol case. They used to put some aspirin in these things. It just happens to fit the cartridges that refill that lancet perfectly. So there you go. There's some refills, and this thing is ready to go. Test if necessary. I want to make sure I go through all my notes here. I don't want to leave out anything important. Okay, that's all that. And then we're left with bandaging materials, which is, these are my standbys. Surgery pads, look how old those are. Wow. All right, these 5x9 surgery pad combine dressings. And then I also have bag balm in here. This is something that we commonly use for chafing or, oh gosh, a lot of different things. You know what you use bag balm for. So that's why it's in here. Remember, this is initial aid kit. And then a big handful of 4x4 dressings here. And that's everything in that bottom, or this main compartment. It started off with, originally it had 11 sections in here, but now I've cut it down to 1, 2, 3, 4, 5. There's 6 here, and this one also still has the ability to be changed if necessary. But this is how I like it. You could take this insert out, and I've got laminated reference sheets in here. This is for that glucose meter, so that if there's anything in here somebody needs to reference out there or troubleshoot with it in the field. Same thing for the digital thermometers. And then the proper way to apply a cat tourniquet if necessary is also in here. That way, if we have lay people trying to help, there's a way. Let's see. I'm looking for, is my tape measure. So it would be somewhere. Now let's see what the dimensions of this compartment are. I don't know if I can demonstrate that or not. That seems a little awkward. On the interior, it's approximately 9 inches to the top there. Is that this visible? Yeah, that's pretty visible. And then in here, you got, like they say, is 12. There's about 12 inches there. And then I guess the most important part is this says it's about 14 inches across there on this interior part. Because I got this bumped right to this, where this piping is in here. So it's roughly 14 inches in there. Yeah, that, yeah, okay. Now I'm gonna pause the video, or maybe not. I'm just gonna put this stuff away. Okay. Put everything away in the Bravo compartment. Now we're gonna move over to Charlie here. Pretty much got that covered. The washcloths. These can be used for quite a number of things. One, they'll be used as an insulator between either the hot or the cold compress. Those instant hot and cold packs really need something between them. That's what this is for. And I don't know how many times I get out and do something I need some kind of towel to wipe my head off with. So here we go. It's a washcloth, and it is intended for all washcloth purposes. That's why it's in the kit. And then we get back into more like wound care here, just like wound care. These are 3x3s. They're open and they're just for doing wound care. They're not sterile. These are more 3x3s, vacuum sealed for compactness, cleanliness. Anyway, just more of the same for treating wounds. And then I also have these moleskin packs for handing out or just sticking in a pocket. So if there becomes any need for it, they're right there, really handy, and they're cut up into little patches. Get to this in a second. And then I have my little bowls here. These bowls are, let's see if I can get this out of here. It's a collapsible bowl. This is really nice. You can set up if you're doing first aid out in somewhere and you want to like clean up a wound or something. You just need a little bowl to put things in. That's what this will work. I use that in place of when I'm mobile. This is what I'd rather have this than try to have something like this. But this is really nice for taking care of wounds and stuff for sure. One of these things. Anyway, it's a Travelon 6-pocket jewelry roll. It's 10.5 inches by 12 3/4. It's perfect for Band-Aids. All the different type of Band-Aids that I use, that's what there is there. I've took each a Band-Aid and then I put it on a piece of paper and then laminated the sheet of paper. That's why there's looks like there's a Band-Aid there. That way I know exactly what I'm looking at. I have to guess. I don't like trying to figure it out through the package. I can just go straight to what I want. And I've got the most common Band-Aids that I use. And then backups. There are boxes and boxes of backups here. So as soon as this gets low, I just refill it. I thought this was a pretty cool little kit for doing band-aids in, and then you can also keep it, I don't particularly like this, but it's got its own closure on it, so it could be kept in a bag. Pretty nice. Yeah, the band-aid kit. I usually like to do it like this, and I don't close it up. And it just goes straight in here every time. No problem. Alright, that's all I have for the Dyna Maxi-Medic bag. That's, I believe I shared my experience and told you pretty good about what this bag's purpose is and all the stuff that's in it, why it's there. This is Unit 13, I'm out.
Rescue 12 en route.
12, copy. Medic 12 responding to 420 Murfreesboro at the Drake. 52-year-old female who is seizing at this time. Her room is 237-237.